We use a lot of hormone replacement therapy in our office, particularly for women at the time of menopause or afterwards. It's an effective way of preventing and reversing osteoporosis, but also hormones will provide increased energy. It makes a woman feel different. It gives her better skin so the wrinkles don't appear or may even disappear. It helps with weight control because a lot of women will gain weight at around the time of menopause before they get started on hormone replacement. It's really not the case that hormone replacement increases weight. It actually works to reduce weight in most women who are being given that properly. Hormone replacement is also effective in men, those who have low testosterone levels, who have muscle weakness and fatigue as a consequence of low testosterone, which needs to be tested in a blood study. One of the best ways of taking hormones is as pellets, and we've been working with this for several years. What you do is make a small incision in the skin of the buttock, just a very tiny incision, a fraction of a centimeter wide, and then you push the pellets in. They're about the size of a grain of rice, so very tiny, just under the skin, and then you put a piece of tape over it. It doesn't require any stitches, and it heals right up in a few days. The benefit of the pellets is that it gives you a constant body infusion of hormones throughout the day for several months. So you don't see levels going up and down every day like you do with all the other methods of using hormones. And the effect of the hormones is just constant. So women who have these fluctuations and notice that their mood changes and they don't feel as well because the numbers are going up and down in the bloodstream are very good candidates for having the pellets done. They last at least 3 months and sometimes as long as 6 months and sometimes even longer. The biggest benefit I've seen with pellets has been in women with osteoporosis because that constant infusion of estrogen, which is in the pellet, maintains the blood level at a higher range, and the effect on the bones is much greater than with any other way of taking hormones. So you can see an increase in bone density about 5 times more than you would see with other means of taking estrogen. We use the pellets in men as well. Again, they will last usually at least 3 months and sometimes longer than that. We measure blood levels of hormones before and after we put the pellets in, and then we follow this along every few months to see what the numbers are doing, and when they start to fall, we'll put in new pellets. Very simple procedure. Takes about 1 minute actually to put the pellets in under the skin, and the patient's out of the office. It doesn't require any preparation or any recovery or anything like that. You can go about your business right afterwards with no difficulty at all.